Hi guys, today we are going to discuss very important topic, one of the very important metabolic disorder, hyperuricemia, or we can say gout. Gout and hyperuricemia both are correlated to each other. As the name indicate, hyperuricemia means the elevation level of uric acid. Means when the uric acid level in the blood or in the plasma exceeded 7.0 mg per dl, it may increase the risk for the gout. When this level of uric acid or urate concentration increases from its optimum level, it may react with the sodium ion and form monosodium urate crystals. Subsequently, these monosodium urate crystals deposited in the joint synovial fluids and sometimes also deposited in the renal ducts, ureters, and collecting duct related to the renal. And subsequently, these precipitation of uric acid crystal in the ureter may cause acute renal failure. Most of the time, this hyperuricemia condition may be asymptomatic, but sometimes it may also cause very much abnormality in the metabolism. Now, guys, we come to the clinical presentation of gout and hyperuricemia. As you already know that these sodium urate crystal deposited in the different part of the body, different joint in the body. Most commonly affected joint is the metatarsophalangeal joint, also called podagra, and also affect ankle joint, heel joint, knee joint, finger, elbow, and wrist joint. These joints are become swollen, and when these attack occur at mostly at commonly at the bedtime, when these attack occur at the bedtime, it may associate with the fever, high temperature, and leukocytosis. If we left untreated any individual from this attack, it may take 3 to 14 days for the spontaneous recovery. Okay, means if we do not give any medicine to the people, or someone sometimes people ignore the symptoms or don't want to take medicine, it may take 3 to 14 days for the spontaneous recovery. Look, guys, we generally adopted two type of approaches for the treatment of acute gouty arthritis. First of all, we suggest for the non-pharmacological therapy, in which we recommend reduced intake of food that contain high amount of purines, such as organic meats. We also suggest to avoid alcohol and encourage people to increase fluid intake. And if someone suffering from the gouty arthritis are obese, we encourage to lose weight with the help of aerobic exercise. And sometimes we also suggest to apply local application of ice that would be beneficial for the pain. Apart from this non-pharmacologic therapy, when we go for the pharmacologic therapy, we generally recommend three main drugs, non-steroidal anti-inflammatory drugs, indomethacin. First is indomethacin, second is naproxen, and third one is sunlidac. All these three drugs are FDA approved. We recommend that the therapy should be initiated with the maximum recommended dose for the gout at the onset of symptoms and continues for 24 hours after complete resolution of acute attack, then tapered quickly over 2 to 3 days. Okay, means we generally recommend maximum dose as soon as possible. We need to give maximum dose for 24 hours and then tapered quickly over 2 to 3 days. We generally seen that acute attack generally resolve within 5 to 8 days after initiating the therapy. Apart from that three main drugs, some physician also recommended following drugs such as etodolac 300 mg twice daily, phenoprofen 300 to 600 mg 3 to 4 times daily. Some general physician also suggest ibuprofen 800 mg 4 times a day, as ibuprofen available OTC drugs in India. and indomethacin 25 to 50 mg 4 times a day for 3 days, and then suddenly taper to twice daily for 4 to 7 days. Ketoprofen has also been recommended as 75 mg of dose for 4 times a day. Naproxen 500 mg twice daily for the 3 days, and then subsequently tapered 250 to 500 mg daily for 4 to 7 days. Pyroxigam, one of the most selective COX-2 inhibitor with least adverse effect, also recommended by the physician as a dose of at a dose of 20 mg once daily or 10 mg twice daily, depending upon the condition of patient. Apart from the beneficial effect of non-steroidal anti-inflammatory drugs, I would also like to aware about certain adverse effect of drugs that are mainly used in the hyperuricemia. Look, guys, every drugs have some side effect, but non-steroidal anti-inflammatory drugs, mostly painkiller drugs, have some traditional side effect like GI effect, gastritis, bleeding, and perforation. Some drugs also affects kidney, may cause reduce renal clearance, renal necrosis. Some drugs also causes fluid retention, increases blood pressure, subsequently causes cardiovascular problems. And some drugs also affect central nervous system adversely. It may impair cognitive function and cause headache and dizziness. Apart from the non-steroidal anti-inflammatory drug for the treatment of acute gouty arthritis, one of the most important drugs that are mostly used because of highly effective in acute gouty attack is colchicine. But the most important drawback of this drug is it has a low benefit toxicity rates ratio. It is one of the type of antimitotic drug. Generally recommended dose is 1 mg initially, followed by the 0.5 mg every 1 hour until the joint symptoms subside. Sometimes the patient develop abdominal discomfort, but remember that the dose of the colchicine, oral dose of the colchicine should not exceed 8 mg per day. The most important adverse effect of the colchicine is the neutropenia. Suddenly, count of neutrophil in the blood is reduced, and axonal neuromyopathy. One of the most significant drug interaction of colchicine with the macrolide antibiotic, especially clarithromycin, when colchicine and clarithromycin administered simultaneously by any patient, it can reduce biliary excretion of colchicine, and that may lead to increased plasma colchicine level. That may increase chances of adverse effect severely. Means when acute gouty arthritis becomes severe, it cannot be controlled with the help of non-steroidal anti-inflammatory drugs and colchicine. In such condition, we need to give corticosteroids. Generally, three types of steroids are preferred or recommended by the physicians, by the specialist. First one is prednisone. Prednisone is one of the most important corticosteroid that is recommended in acute gouty arthritis. Generally, recommended dose of prednisone is 30 to 60 mg for 3 to 5 days once daily. But upon withdrawal, after 5 days, upon withdrawal, there is a withdrawal symptoms or there are chances of rebound attack. So generally, we recommend that the dose should be gradually tapered in 5 mg increment over 10 to 14 days and then discontinues. Okay, guys, means prednisone should not be stopped suddenly. It should be tapered in 5 mg increment over 10 to 14 days and discontinue to avoid steroid withdrawal symptoms or to avoid rebound attack of acute gouty arthritis. Now we come to the another steroids, that is triamcinolone hexacetonide injection. It's an intra-articular injection of 20 to 40 mg. It may be useful for the acute gouty attack, but it should be limited to one or two joints. It should not be recommended for more than two joints. Okay. Now we come to the third point, that is adrenocorticotropic hormone gel. Generally, it is also given intramuscularly every 6 to 8 hours for 2 to 3 days and then discontinued. Now, guys, we come to the conclusion point. We have already discussed the drugs that are mainly used for the treatment or for the acute gouty attacks. We have discussed about non-steroidal anti-inflammatory drug, how these drugs act, and what is the adverse effect of that drugs. We have discussed colchicine earlier. Now, apart from that drug, I would like to discuss some prophylactic therapy for the intercritical gout, means maintenance therapy to avoid gouty attack. So, guys, I have already discussed about the colchicine, that is uric acid lowering therapy. Means colchicine used to reduce the level of uric acid in the body. Now there are another two important drugs that generally used as prophylactically. First one is allopurinol, that is xanthine oxidase inhibitors. Mostly allopurinol generally inhibit xanthine oxidase enzyme and inhibit the formation of uric acid in the body. Recommended dose of allopurinol is 100 mg per day. And the another drug is probenecid. It is also called as uricosuric agent. Means probenecid increase the excretion of uric acid from the body, and its recommended dose is 250 mg twice daily. Okay, guys. So now we have studied non-steroidal anti-inflammatory drugs for the treatment of acute gouty attack, colchicine drug, that is antimitotic drug, uric acid lowering therapy, allopurinol, mainly used to inhibit the formation of uric acid in the body at the recommended dose of 100 mg per day, and the probenecid, that is also called uricosuric agent, increase the elimination of uric acid from the body and control the level of uric acid inside the body and maintain its optimum level to reduce the chances of gouty attack. All these are about gout and hyperuricemia.